My name's Rebecca Harris. I'm a Professor of Dental Public Health at the University of Liverpool, and today we're presenting the results of the Return project, which was funded by NIHR back in 2018. And the Return is all about people who use urgent dental care for, as their regular means of getting dental care, to help them, support them into using dental care routinely. So basically this is a 7-year funded trial funded by NIHR as what's called a programme grant for applied research, funded basically for us to work with people who were relatively disadvantaged and to learn and listen about what their barriers to using dental services routinely might be, and to work with them in order to develop an intervention that might be delivered to people who had turned up at urgent dental care services wanting urgent care. And the vision for the intervention was it should be delivered in 15 minutes when they were visiting urgent care, and it was going to be delivered by dental nurses in terms of a conversation with some supportive activities. So the elements of the intervention are firstly a conversation with the dental nurse who approaches the patient in urgent care. The dental nurse then shows a short video, and we've got 6 videos reflective of the 6 barriers to care that we identified. And accompanying those videos is a supportive booklet with the behaviour change messages about that barrier. And so we needed to recruit over 1,000 adults who hadn't been to a dentist for 2 years or more and who didn't have their own dentist at the time when they were enrolled in the study. And I think it is an indication about what a sizable issue this is, that we actually achieved that recruitment in those situations of 1,179 people were recruited, and we did that in just 6 weeks past that 12 months target. So we followed them up for 6 months, 12 months and 18 months. And in parallel to the statistical analysis, we've also got the health economic analysis that asks the question, does this both improve health and also save costs to the NHS, even in a really, really challenging environment where it was very, very difficult to get, for anybody in Liverpool and around, to get an NHS dentist. The intervention did support people from urgent care into routine care, and people that got the intervention, it saved the NHS money in order to do that. This model proves that you can actually meet people at a teachable moment in urgent dental care. You can involve people from quite a disadvantaged background, and it really helps reduce health inequalities in terms of taking up care in a planned way, and ultimately to their benefit of reducing antibiotic use and improving their life and their employment chances in the longer term. This resource helps address health inequalities, and I think it's a really important thing that we should have within the NHS dental system. We need to focus it on people who are most in need. And the people who are most in need, who have the most disease, are people from these most disadvantaged environments. And so we need an intervention like this to support them. This intervention that we've developed saves the NHS money. It helps individual people who are relatively disadvantaged in life improve their quality of life and their lifestyle, and it helps them get into planned care.